Florida gets its own video today because Florida officials clash with voters over medical cannabis rules. And I have a video in a minute of some, they had a bunch of these public meetings where it was like, they asked the public to put in their 2 cents on the marijuana laws, specific laws that they're going to write about, the medical marijuana program that is now a constitutional amendment in Florida. If you remember me, I guess if you watched it, I did a video where I mentioned Florida's constitutional amendment being unworkable, like monster, and they had kind of a limited time which they extended for them to put together this program. But it's still very limited. There's no smoking. There's no home growing. There's no, more or less, it's still people that get the high potency cannabis are people that have serious debilitating conditions, are near death. Then there's this 90-day waiting period where the doctor-patient type thing, where the doctor sees a patient and they're, going to prescribe them medical marijuana. High potency, well, you got to be a specific list of people. I think there's only like a couple things on it. Either way, 90 days. You have to wait 90 days before you can actually get the medicine or whatever. And that's just absurd. And furthermore, now there is some medical marijuana providers in Florida that have this non, smokable. It's not smokable. It's other forms of cannabis made from the hemp, basically hemp potency level of cannabis. I don't even know what it is, to be honest, but it's really expensive, and people are having a easier time finding medical marijuana products on the street illegally because it's cheaper. So anyway, in Tallahassee, 3 months after Florida voters overwhelmingly approved a constitutional amendment on medical marijuana, state health officials and prospective patients are at odds over proposed rules that would spell out who could get cannabis. State officials have recommended restrictions on what type of patients can qualify for medical marijuana and where they can obtain it. Because they didn't ask any other state about this. They didn't say, well, who should we let have it? They're just going totally blind, like nobody's ever done this before. Okay, here we go. Their suggestions, however, have prompted a wave of opposition across a state, with nearly 1,300 residents attending what are normally low-key bureaucratic hearings to press for less restricted access to marijuana. Patients, doctors, caregivers, and activists all had a unified message, which is rare, said Ben Polera, who is a campaign manager for United for Care. Quote, they want impediments removed and a free marketplace. Good luck with that. Amendment 2, which is approved by 71% of voters last November, was enacted on January 3rd. It allows high-strength marijuana to be used for a wider list of medical ailments than what was currently allowed in state law. The rules have become a flashpoint because the amendment requires the state to adopt them by July 3rd and have them in place by September. The state held hearings in several locations, and Thursday's 2 hours of public testimony in Tallahassee mirrored what happened earlier this week in Jacksonville, Fort Lauderdale, Tampa, and Orlando. Most who spoke statewide are also concerned about high prices and limited availability so far of cannabis products. Only 5 of the 7 organizations approved to dispense cannabis are even up and running at this point. Activists want a requirement eliminated that a patient must be under a prescribing physician's care for at least 90 days. So, yeah, that's terrible. They also believe it should be up to doctors to deem when medical cannabis is necessary and not be confined by the conditions enumerated in the amendment by the Board of Medicine. And, yeah, that's the way a lot of states are going. But even in Michigan and a couple other more liberal states, they still require you to go through a panel to approve new things that can be approved for medical marijuana. So to hope for a wide open relationship between doctor and patient like they got in California and other places, I don't see that happening ever in Florida, but whatever. I mean, they can hope for a lot of things and then maybe get halfway there on a compromise. So there's another take on it. Out of Kissimmee, a parade of horribles seems endless for the local government officials grappling with the anticipated green rush in Florida after voters in November overwhelmingly approved a measure legalizing medical marijuana for hundreds of thousands of patients with debilitating conditions. Now, this green rush they're talking about in Florida, give me a break. With the laws they got, they're not even going to be able to, most of these places are probably going to go out of business. Okay, meanwhile, the local moratoriums, temporary bans, and permitting and zoning for dispensaries are intended as status quo placeholders while officials wait for lawmakers or the Department of Health to impose new rules, which they're busy doing right now as we speak. Quote, I don't know that there's that many cities that are hardcore against it. A lot of them are in the sense of if we gotta have it, that's fine, but we want to make sure they're in the areas where it's safe, away from traffic, away from schools and all that sort of stuff. Florida League of Cities Assistant General Counsel Ryan Padgett said recently, quote, this isn't a CVS or Walgreens when talking about dispensaries. Dispensaries are in a different ball game. And a lot of people are trying to distinguish what category we put these in. How about just putting them in a situation where people are going to get medication from a facility? Okay? Is that okay with you? Because that's what's going on. Powerful odors, fire hazards, a number of volatile chemicals can be used in the enclosed spaces that process the cannabis products. And traffic congestion are amongst the issues local officials are concerned about in an industry that state lawmakers have said they will not tax because it is a medicine. That's great, because, you know, you're going to save so much money by not enforcing dumb marijuana laws, and you don't have to tax it. As long as if you let local people handle the growing and processing and selling of it, you wouldn't have to worry about taxing it because then people would be pumping money back into your economy like what happens everywhere else. So once again, why don't you ask somebody else, another state, who knows about these things before you go ahead and assume things? Now, this stuff about powerful odors and fire hazards and all this stuff, you're not talking about a dispensary. Dispensaries don't have powerful odors and fire hazards. That's grow operations, all right? You can put them in you can zone them in different areas so they're not in places where that's a problem. That's not a big deal, but why bunch dispensaries in with this conversation? The process, spaces to process the cannabis products, yeah, that's it. You can do whatever you want about that. Just don't act like a dispensary is that, because earlier the whole thing was about this ain't a Rite Aid. Well, it pretty much is. It's not any one thing, but it's kind of that drip, 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 drip that has a lot of cities concerned, Padgett said. We're going to have to do all this extra stuff to deal with this. That's going to take resources, and somebody's going to have to pay for it. How about the resources you used to use to process marijuana cases? You had to send stuff to labs and pay for that. You had all these people sitting around in your jail leeching off the system. So don't give me this bullshit about how implementing medical marijuana laws is going to cost you anything. Let people have their licenses to do what they're going to do, charge them for their licenses, and you make money. Just look at states that have done it, and once again, if you had to go to the bank with a business plan, you would lose, Mr. Padgett, because you didn't do any research. You didn't call anybody that has data for you. You're just flying totally blind. And then we have Christian Backs. This is the guy who's supposed to be your friend. He is the Office of Compassionate Use Director. He's not very compassionate. His office don't give a fuck about you. So about 2,000 patients are registered in the database, but that number is expected to eclipse 500,000 before the end of the year, according to Florida Department of Health estimates. Again, if their marijuana program looks like it does right now, or it goes in the direction that it looks like they're taking it, I wouldn't worry about no 500,000 people being patients to that. What I would worry about is your black market handling those patients, because right now you're not even letting people smoke or grow their own weed. That's absurd in 2017, but it's Florida, and it is down south, and they are, really right-wing Republican. So anyway, here's Bax. This is coming out of a city or county where you live very soon. This is coming to a city or county to you very soon. State Office Compassionate Use Director Christian Bax told a packed audience of more than 350 elected officials, industry representatives, and hangers on Saturday at the Florida Association of Counties Medical Marijuana Summit. You're going to have people who think marijuana is just legal. You're going to see people who think they can just grow it in their backyard. You're going to see people who think that because they've been ordered it by a doctor, they can consume or overconsume and get behind the wheel of a car, Bax said. So apparently this dummy Bax don't know anything about the marijuana stuff going on. So he's talking about consuming and overconsuming marijuana. That's arguable, that it's almost impossible to overconsume. But if you do overconsume, you're probably not going to drive because you're going to be sleeping, man. So Christian Bax, he looks like a clean, sober kind of guy. Maybe he don't know anything about marijuana. Maybe he does. I don't know. I think he's just saying these things that he's saying because it's like what he gets paid to do. He's paid to throw a big-ass wrench in this medical marijuana program. You better believe it. Because Florida is the pharmaceutical industry's playground, man. You're talking about medical marijuana. They're going to make this the worst program ever. It's going to be the slowest rollout ever. It's going to be garbage in and out. It already has been so, since its inception before this, with that low THC marijuana for virtually, you've seen the numbers, 2,000 patients Florida-wide on their old program. It's garbage. It's garbage. And this new thing ain't a whole lot better. And they're not trying to make it any better. They're trying to make it worse. Not really, but they're, like he just said, they're trying to make it so people think they actually can grow some plants or something, whatever. Bax always predicted that gray markets would begin to pop up. They already are. There's black markets in Florida. Are you kidding? It's because you guys don't let anybody smoke weed. And that's why the markets are there. You don't let anybody register to sell marijuana to adults like alcohol and tobacco. If you do that, then you won't have these gray markets and black markets. That's a simple fact of life. Any government official anywhere that complains about gray markets or black markets should look at their actual market, if they even got one. If they don't have an actual market, they have no business complaining about other markets that emerge because cannabis is a demand product. It's a product that's always been in high demand. There's never been a time ever in history where marijuana had a low demand anywhere. So you're just ridiculous when you complain about this. So this next thing is really funny. He says, you're going to see people who are at best confused and at worst doing something inappropriate and hanging a shingle or attempting to hang a shingle without any kind of license or approval. I assume his shingle hanging analogy is talking about someone growing, processing, or selling marijuana. So essentially he's saying that the government has to do it for you because not everybody can do any of these things. So we're going to have to figure out some people that can and get them doing it. All right, now I'm going to go over this video here. I'll let you watch this video. I may stop it and comment as it's going. I probably will, or I might just let it go.
As we move forward with implementation of Amendment 2, we're very interested in hearing from our constituents, which is all of you in this room, and that's what brings us here to Orlando today.
Part of the rulemaking process is to issue a draft rule, which is what you see today. It is the first step of this process. The second step of that process is to go through with public comment.
I think it's important that we do away with this 90-day requirement for patients to have this relationship with doctors.
At present, I have over 100 patients waiting for me to recommend medical cannabis to them, assuming they do not end up like 12 of my former patients who passed away before the 90 days made up, or they made up their 90-day requirement. A week doesn't go by where a patient, a family member, or a referring provider calls my offices to make an appointment and refuse to make the appointment because of the uncertainty that they will be alive
Get
within
rid
those
of it,
90 days
Bax.
or at the
Get
90
rid of
day
this
mark.
90-day thing.
The second time we passed it, the people voted for it and approved it, but government bureaucrats are working in conjunction with the big companies, millionaires, to get even more money, while people can grow it in their own homes, on their own property, knowing what you put on the plant, you know what kind of fertilizer you use, you know what kind of chemicals you might have. I have no idea what the companies are doing. You think I trust a big company? No, I do not trust a big company. So you guys who work for me,
You're putting yourselves in between my doctor and myself and my medication. That's wrong. These doctors know what they're doing.
Yeah,
They
that's
know their
your right-wing
jobs.
government
Y'all don't
for
have
you.
to tell them anything.
Always want to be
Let
small
the doctors
government.
do what they.
You notice how the right-wing government officials, they always talk about small government, low regulations, no regulations. Let's get a regulations and get them out of here. When the marijuana legalization hits their area, their tune changes real fast. I mean, all of a sudden, every little thing needs to be regulated and every little precaution needs to be taken. And they're totally trying to get right in between you and your doctor on making decisions about your health.
Don't interfere.
1, it must be affordable. It is currently not affordable, and that is why my daughter is not in the registry yet. Patients are also having problems getting product, as the few dispensaries are not able to keep up with the meager amount of patients in the registry. No point spending hundreds of dollars for a doctor who has taken your course only to not have consistent product available. You have got to allow for an open market.
I want to be able to grow my own medicine.
Brother.
There's a thing, we don't even begin to understand the plant. There's terpenes and things and these strains that these medicines are so unique.
Organic
and
growing.
when you restrain it to just 7 entities, I won't be able to find the exact thing that maybe can help me. And maybe I just need that little bit of limonene, or I need that myrcene at night. I need the different medicine at different times.
I need my options. And if not, I may die. And my blood will be on your hands. The more difficult you make it for me to have access, in comparison to Santa Fe, New Mexico, where there were 70,000 people, I had 4 dispensaries at my disposal, at my beck and call.
Thank you, ma'am. We appreciate it.
I mean, again, they have 7 dispensaries that are supposed to be in operation, and only 5 of them are in operation for 2,000 patients currently. I live in a town about 2,000 people strong, and I know they don't all have medical marijuana cards. We have 7 dispensaries in my town. So I don't know what the hell they're doing in Florida, man, but it's terrifying. It's gross. It's not medical marijuana what they're talking about. And they're slowly trying to implement a situation where they control the marijuana products being sold. They control the production and the processing and all that stuff. Meanwhile, they're on TV telling you this propaganda line about how we can't have a dispensary here because, you got these dangerous chemicals and marijuana processing areas might blow up in your face and, the odors and stuff. And they're talking about a dispensary when really the production is controlled by them already. There was, this Florida is probably not going to get this right. I hope they do. But right now, I don't have any really optimistic thing to say about the Florida's situation. Now, Christian Bax did say that he was there to listen to people. He didn't make very many comments. He didn't take any questions after any of his sessions, talking to people, talking to the citizens in all those cities. But what he did do is when he talked to the media, he used the same old propaganda that everybody else uses. And I'm talking about that extra cautious, tippy-toe, let's be really, really careful because this is cannabis and THC gets you high. And it's the same old crap I'm hearing from all these right-wing places that have to deal with medical marijuana now that the people have legalized it. And you're going to see this everywhere. And it ain't even just the right-wingers. In Massachusetts, it's, the Democratic congressman from I can't even remember, some Chesterfield or something. Just ridiculous, man. Get it right. Give the production back to the people. You got to let your people grow. That's the only way I see it being medical marijuana. You can still have dispensaries and you can still get your money, and you can, without even taxing it, the state can get money from fees and stuff. There's ways of doing it. Just look around, see what you like out of other people's programs, and implement something smart. Florida is not doing that at all. The people that are trying to put this shit together, they're not implementing any kind of ideas based on anything but ideologies. And that's what right-wingers are famous for. They dream ahead. They're like, oh, if we do this, that'll happen. Yeah, if we give tax breaks to the rich, the money will trickle down. If we, what's another great one, you know? I don't know. Every one of their stupid theories is ignorant. You know, if you make marijuana completely illegal, then younger people won't use it. You know, that's the biggest bullshit they've ever used. Or it's a gateway theory in general. That's another one that has been proven wrong time and time again. So, no, don't use your ideology tinfoil hat about medical marijuana laws. Go to states that have them, see what works. I think Colorado and California's got some really good programs. Check them out. See what's going on. Meanwhile, your people are suffering. Get it right. Safe access for all. And home growing should be a fact of life in any medical marijuana situation.